Nurses. We're talking about nurses. I say that because we're now at the demonise nurses stage of a crumbling Conservative government. Now, the narrative we've all been fed is that nurses going on strike is a threat to our health, a threat to the National Health Service, all because these notoriously greedy fat cat nurses want their pie-in-the-sky, astronomical pay rises. Now, let's just listen to Rishi Sunak, who, unfortunately, happens to be our Prime Minister.
And there is a human cost. Alex from Chester has been waiting for a gallbladder operation for nearly 6 months. He's in so much pain, he's been off school since then. His operation has already been cancelled twice. His mum, who I spoke to this morning, is worried sick. When she heard that strikes could be called off, she was massively relieved. She's desperate for the Prime Minister to resolve this. All he needs to do is simply meet the nurses. Now, Alex's mum is listening to this. She doesn't want to hear him blaming everybody else. She doesn't want his usual ducking of the question. She's tuned in now because she wants him to explain what is he going to do to resolve the nursing strike.
Well, Mr. Speaker, it's not just Alex. There are millions of others across this country, Alex and Mark, millions of others who will have their healthcare disrupted because of the strike. Now, the honourable gentleman says to get round the table, but we all know what that means, Mr. Speaker. That is just simply a political formula for avoiding taking a position on this issue. If he thinks the strikes are wrong, he should say so. If he thinks it's right that pay demands of 19% are met, then he should say so. What's weak, Mr. Speaker, is he's not strong enough to stand up to the union.
God, he's pathetic. Now, we should all be unapologetically supportive of our nurses who enter the profession for one reason and one reason alone, because they care. Because these are the army of health workers, of course, who look after millions of people at their most difficult and their lowest moments, who carried us through the pandemic, the worst crisis since World War II, the just unbelievably hard-working frontline staff who I think all of us probably have a story that we could share showing how much we owe to them. The least we can do is to support them. Frankly, the lack of gratitude of those who refuse to do so is off the charts. But guess how much nurses, on average, are being paid less a year compared to 2010 when the Conservatives came to power? Maybe you think it's £1,000, £2,000, £3,000, that's a lot of money, £4,000, incorrect. £5,000 on average, nurses being paid less than when the Tories came to power. Just to put that in perspective, Dancing on My Own by Robin was at #1 in the charts. It was a long time ago. In the last year alone, the pay of nurses has fallen by £1,800. Just gone. Whoosh! In real terms. Now, if you want to talk about other health workers who, of course, are taking action, the paramedics, for example, their pay is down by £6,000 a year since 2010, and in the last year by nearly £2,500. This is preposterous. It's absolutely preposterous. It's no wonder that we've got nurses being driven to food banks in this country. Now, even if the nurses got what they asked for, and bear in mind, given inflation, it's only a few points in real terms above what the level of inflation is. It's only a few points real terms pay rise. They still wouldn't go back to where they were in 2010. They would still be poorer than they were in 2010. That's what we're talking about in practice. This takes me to a central point that I really think has been missing in this so-called debate. Now, Tory ministers keep saying that they can't give nurses a pay rise because that would mean taking money away from frontline services for patients. Now, hold on a minute. What do people think frontline services actually are? Do they think the NHS is manned by robots? Sure, there's medicines and drugs, largely it should be said, created through public sector research and then repackaged by big pharmaceutical companies as lucrative products they can force the NHS to pay extortionate prices for. We should have that discussion at some point, by the way. There are actually machines which are manned and operated by human beings. The frontline services of the NHS are overwhelmingly, of course, its staff, like nurses. That is what the National Health Service is. What else do people think it is? That's why when nurses go on strike, there is a problem that suddenly we have to talk about because of how much we depend on nurses. Now, this country is being subjected to a very interesting, but I would say disturbing experiment. And that's what happens when a wealthy nation stops spending enough money on the health services it provides for its people. Well, I'll tell you what happens. Morale starts to collapse, and crucially, you struggle to retain nurses and to recruit nurses. Do you know how many nurses left the NHS last year? 1 in 9. 1 in 9 nurses. Do you know what percentage of nursing posts are vacant? Around 10%. What does that mean in raw numbers? 10,000 missing nurses? 20,000? 30,000? 40,000? Approaching 50,000 nurses. What does that mean? It means the NHS is not capable of providing a sufficient level of care for the people it exists to treat. It means people becoming iller than they otherwise would. Now, let me be very straightforward about this. What about the consequences? The consequences mean that some of you watching or listening to this will find yourself on trolleys in rammed hospital corridors, not getting the help you need. And I'm afraid to be very direct and macabre about this, but some of you listening to this or watching this are going to die. You're going to die because you're not going to get the care that you need. And you're not going to get the care you need because there isn't enough nurses. And there isn't enough nurses because they're not being paid properly. That is the cost of these decisions in practical terms. That's what happens when a government stops spending enough money on its health services. It's also a false economy, because if you let people become more ill than they otherwise would, what happens then? Well, down the line, the NHS has to pay more money, obviously, because they're sicker than they would have become. It also means, in terms of the economy, it means more people taking days off work because they become unnecessarily sick. And that has, obviously, it means a huge sum of money is lost to the economy. That's why this strike could save lives. Yeah, a nursing strike, not ideal. I mean, obviously, the fact we notice it underlines just how important they are. The difference is, of course, there will be cover for those who need it. Nurses, above all else, care for their patients. The real problem isn't a strike which imposes a temporary loss of service. It's the permanent loss of service that is now baked into the National Health Service because of the government's own decisions. Now, if we retain more nurses, if we recruit more nurses, then we will save lives. And that is why the nurses' strike could end up saving lives. It will save lives if their demands are met, because it will mean more retained and more recruited nurses, and therefore a better standard of care. And that's why it's so important. This isn't just the nurses striking for themselves. They really are striking for all of us, because if they succeed, then they will help ensure that we have more nurses, a better standard of care, and more people are stopped from becoming ill and from dying. That's why they're striking for all of us. We owe it to them to support them, but there is a wider point about society itself. The nurses don't exist in isolation. They care for us, as I've said, at some of our worst moments, and we don't just owe it to them to support the strike, we owe it to ourselves. Please like, please subscribe. I'll see you next time.